still remember that night like yesterday. I couldn't stop scratching. And no, it wasn't just a mosquito bite. I had contracted scabies. I was in high school and lived in a crowded student hostel. Like me, did you know that over 300 million people worldwide yearly contract scabies? Now let's dive into the itchy truth behind this skin infestation. So I'll be answering questions on what causes scabies, how do you know you have scabies, and treatment options open to you if you have scabies. So you'd want to work with me to the end of this video. And if this is the first time you're seeing my video, please subscribe and share to your friends. Do not forget to turn on the notification bell. Scabies is a skin infestation caused by tiny mites called Sarcoptes scabiei. These mites burrow, live in the skin, and actually lay eggs. This causes relentless itching and an angry rash. Another hallmark of scabies is the appearance of track-like burrows in the skin. These raised lines are usually grayish-white or skin-colored. They are created when a female mite tunnels just under the surface of the skin. After creating a burrow, each female lays 10 to 25 eggs inside. Scabies mites can live anywhere on the body, but some of their favorite spots include between the fingers, the folds of the wrist, elbow or knee, around the waistline and navel, on the breast or genitals, the head, neck, face, palms and soles in very young children. Most people with scabies only carry 10 to 15 mites at any given time, and each mite is less than half a millimeter long. This makes them very difficult to spot. To the naked eye, they may look like tiny black dots on the skin. A microscope can identify mites, eggs, or fecal matter from a skin scraping. Scabies typically spreads through prolonged skin-to-skin contact that gives the mite time to crawl from one person to the other. Shared personal items such as beddings or towels may occasionally be to blame. Scabies can be passed easily between family members or sexual partners. It is not likely to spread through a quick handshake or hug. The scabies mite cannot jump or fly. It crawls very slowly. Anyone can get scabies, but those at higher risk include sexually active adults, prison inmates, people in institutional care, people in crowded conditions, people in childcare facilities. When a person is infested with scabies for the first time, it can take 4 to 6 weeks for the skin to react. The most common symptoms are intense itching, especially at night, a pimple-like rash, scales or blisters, and sores caused by scratching. In its early stages, scabies may be mistaken for other skin conditions because the rash looks similar. What sets scabies apart is the relentless itching. Itching is usually more severe in children and the elderly. In most cases, a doctor can identify scabies based on the appearance of the rash and description of the itch. Sometimes, a skin scraping is used to confirm the diagnosis. This involves collecting skin from the affected area and using a microscope to check the sample for mites, eggs, or fecal matter. The intense itch of scabies makes it difficult to resist scratching. Frequent scratching can create open sores that are prone to infection. Bacterial skin infections such as impetigo are the most common complications of scabies. Symptoms may include honey-colored, oozing blisters. This type of infection is usually treated with antibiotics. Crusted scabies, also called Norwegian scabies, is a very severe infestation involving tens of thousands of mites on a single person. This causes the skin to develop thick crust full of mites and eggs. Crusted scabies is most common in people with weakened immune systems, the elderly, and the people who are disabled. This type of scabies is highly contagious and requires swift treatment to prevent outbreaks. When someone is diagnosed with scabies, anyone who has close physical contact with the person should also be treated. Close contacts include bathing together, sleeping in the same bed, or even holding hands. Doctors usually recommend treating all members of the household, even if symptoms are not present. Remember, it can take 4 to 6 weeks for symptoms to appear. Scabies will not go away on its own. It can only be cured with prescription medications that kill the mites. Treatment is a cream or lotion that is applied to the entire body from the neck down in most cases. It is left on for 8 to 14 hours, then washed off. In most cases, a doctor prescribes pills to treat scabies. Treatment takes up to 3 days depending on the medication used. While prescriptions can kill scabies mites and their eggs, they do not provide immediate itching relief. To control itching, especially at night, antihistamine pills can help. Hydrocortisone cream may also help, but it can change the appearance of the scabies rash, making the condition harder to diagnose. It's best to use this cream only after your doctor has confirmed the diagnosis. Scabies mites can live up to 2 to 3 days on the surface of clothes, bedding, or towels. To make sure these mites are killed, wash any sheets and clothing used by the affected person within the past 3 days. Wash the items in hot water and dry them in a hot dryer or take them to a dry cleaner. Items that can't be washed should be placed in a sealed plastic bag for 7 days. Reading the home of scabies is really important, as scabies can also be transmitted by fomites. By fomites, I mean furniture and some other things the affected person may have come in contact in the house. So it is very important. Thank you for staying to this part of the video. I hope you like it. Subscribe and tell me in the comments, how do you like my voice?